মোবাইলটা নিয়ে যা। Good evening. According to my understanding, today's class is very important for using knowledge regarding real homeopathy. I always try make the subject easier. Following this, I have asked many times myself, is this point easy for the students, for followers? Actually, I follow two things. One is how I can understand, and another is how can I make it understand to others. I know this is not satisfactory for me. When I read anything, when I write anything, I consider two things. What I have written, is it correct? Is it reasonable? Or when someone will read, how they can understand, what they will think when I will be not in the world. Then those who are not my student, those who will come for learning real homeopathy, how they will consider this one. Is it scientific? Is it reasonable? This time, I am thinking over a lot on this. When the new next generation will come to learn this, how they will learn, how they will think over my invention. Considering this thing, I started this idea in Meseda, Mednipur. I go there once in a month, and after treating patient, so many students are there. I explain how I have prescribed, and they always see the marvelous change within a few minutes. As associated with this, I want to explain how I have done it, how they will do it. Lots of complicated cases are there, and they become very helpful. After taking, within a few minutes after taking medicine, high pressure, severe headache, severe cancerous pain, God is helping me in all respect. I start medicine. I want to know the change in that very moment. May it be any type of complication are there, but always I do it. And there are some students are there. They bring their patient. So no burden for me. And also with this patient, I learn, I tell them how to learn, how to use this idea. Doing this type of idea came to my mind this month, May, in the month of May. I went there, I think, 1 week ago, or like this, 21st or like this. That if I ask, as I am asking myself, and I can ask others, they have to give answer. And how they will give answer? The way they will give answer, this is the procedure, how to learn. Let's go straight for that very 22 questions. I think screen is visible. Few reasonable questions. And that question you should know. The answer of that very question you should know. And when you will teach your student, you should take the help of this thing. So today's class is in that sense is very useful and important, and also very interesting. I have made this chapter after thinking a lot. The first question: treatment start with 5 potencies. You know well. When and how long it should be continued. When you will start treatment with 5 potencies? The first day for new patient, you should start treatment. But see, I have written here only with hydrophobia, but it should not. If there is reversible, you should start with hydrophobia. If the case is having irreversible pathology, you should not start with hydrophobia. Never. You should use never as fast medicine hydrophobia. You should start with Drosera. Hydrophobia will come when patient will not respond with Drosera, then he will go with that very hydrophobia. But no problem if you start with hydrophobia. But one thing, mind it, those who are coming to you after hearing your name and fame, they come to you. And you have given 5 potencies for 5 days or 2 days or like this. No response. Please consider that very point. What that very victim will, that very patient will think for you. Because patients are very straight cut. After taking medicine, some change should be there. If it is not, they will be disappointed. That is why correct first prescription is very important. So you should use your knowledge that is this case is irreversible pathology or reversible. For knowing this, you should ask that very patient that you have come to me for this and this problem. Right? Now you please think over this. This type of suffering you have seen in your mother or father. Don't give answer so quickly. Please think. This type of problem was with your mother or with father. Sometimes patient, before asking the question, sometimes patient will tell, sir, this type of joint pain, I have got it my grandfather, and it was also with father. I would know this will happen for me. I have seen it in my grandfather and also in father. They spontaneously start this statement. So you see, you have to start with Drasra. And how you will start? I have written it with the help of hydrophobinum. You know all these things? First day CM, second day 200, may it be hydrophobinum or Drosera or sibilinum. If the patient is having irreversible pathology and also with having past history of tuberculosis, then you should start with sibilinum. Okay, you may start with hydrophobinum or Drosera or sibilinum, and you have to use it in this way. But here is two words. One is gradual change towards positive, and another is excellent improvement. Very important, these very two terms. If you observe, if your patient is telling, yes, sir, your medicine is helping me, I am happy with your treatment. This is one thing. Another thing patient will tell, sir, you are like my God, because after many years, I enjoyed sound sleep last night after having your medicine first night. And clear bowel movement. And now my appetite has increased a lot. So this is called excellent improvement. The expression is like this. You can understand. You will understand after seeing that very expression. There is excellent improvement. Otherwise, patient will tell, sir, yes, your medicine is helping me. Which medicine? You can ask. No, sir, all 5 doses, I have used it, I have taken it according to your instruction, and I am feeling good. My sleeping pattern has been changed, my appetite has been changed, my bowel movement has been changed, my thoughts process has been changed. Now I am happy with your treatment. If it is, then you have to use next, after 5 potency, then you have to use Next medicine, 5 potency. If you start with hydrophobia 5 potency, then after this one time use, you should go Drosera. Then also this type of improvement, that gradual improvement, you have to go civilinum. Then you have to go carbobase, carbonilis, you know very well. Sorinum, Puja occidentalis, Rhinum, again hydrophobinum. And then you have to learn from your patient from which medicine, which potency the patient is benefited a lot. It is in case of gradual improvement. When there is excellent improvement, then that very medicine you have to use in different round. Should not change medicine. So these two terms is very important. That is why I have written it with reading. One is gradual change or gradual improvement, otherwise excellent improvement. Question was, treatment established by potencies when and how long it should be continued. I have told you how long it should be continued. When there is excellent improvement, you have to use that very medicine in different round. If there is gradual improvement, then you have to use it one after another. Second question, when treatment with 16 potencies should be started, how long it should be continued? Yes, very important. You are using 5 potencies. But one thing you have to think about this. When there is gradual improvement, then you will use all 8 medicines. After using all 8 medicines, you have to learn from your patient which medicine, which potency give the patient a comfortable life. Then you have to use that very medicine. And another thing is, when patient will tell you, but from patient version, from patient statement, you will understand, yes, here is excellent improvement with civilinum or with DOS or with ibuprofen. You can know only from the expression of your patient, from the expression, how he or she will expressing his improvement. Yes, after the expression, you have learned that this XYZ, this medicine is doing that very excellent job. Then you have to use in different round, CM200, 3, 2, 1, CM200, 3, 2, 1, CM200, 3, 2, 1. But how long? Patient will tell. Sir, which medicine you have given? It was very helpful for me up to the last week. But this week, I am not benefited. Please do something. Then you have to go 16 potencies, means 0 by 15, 0 by 18, 0 by 21, 0 by 24, 0 by 27, 0 by 30, 33, 36, 39, 42, 45, 48, 51, 54, 57, 60. 16 potencies. Then when you will go to 16 potencies? When 5 potency, previously 5 potencies is working a lot, working very nicely. But for 2-3 days, these 5 potencies are not working at all. That means improvement has been stopped after going certain level. Then you have to go 16 potencies. But one thing I have to tell, when you are using 16 potency of certain medicine, say after 0/27, there is aggravation of suffering. Then you have to use next potency also. After 27, you have to give 30. You should not come back. When you will heard from your patient, the patient is complaining that with this very certain potency, say 33. After 33, there is aggravation. Previously, I told you, you should come back to 0 by 3, not now. But not, I am not telling this now. When patient will claim against one potency, you should not go back immediately. You should give medicine next potency fast. If it is 33 it was, then you have to go 36. And you may see after 36 the problem has been solved. So you have to go next potency. After 36, 39. After 39, 42. But if you see, patient is telling after 33 there is aggravation of suffering. And you have used 36, no improvement, again aggravation. Then you have to come back to 0/3. So mind it, this thing I never told you. After one potency, if there is 100 potency, if there is an aggravation, you have to go next. I don't know, I have written here or not. I am seeing. If it is not written here, then I will write down. I am putting some gap here. I think I have not written here, which I have told you just now. So again, I am telling, with any higher potency, if there is aggravation of suffering, previously I told you, you have to come back to 0/3, 0/2, 0/1. But now I have changed my idea, not myself. What I am telling you, I have learned from my gurus, that means my patient. And I have seen. After giving next higher potency, if there is everything is okay, then you have to proceed. But if the next higher potency, it is worse, the condition is worse, suffering is aggravated, then you have to come back. There is no option. And how long you have to continue this one, this 16 doses, till the expected result you are observing in your patient. Till that time, you have to use it in different round, 15 to 0 by 60, again 15 to 0 by 60, again 15 to 0 by 60. Third question. This class will be in Bengali in third Sunday, because this information is very important for you, for all of you, even myself. Actually, I learned from my, I have two sources. One is my guru's patient, another is when I am sharing this knowledge with you, then also I learn. So there are two sources for my learning. When treatment with three potencies will be needed and how long it should be continued. Just now I have told you, but here I should written before with answer of question number 2, I should write down that after aggravation of any higher potency, when there is an aggravation of suffering after any higher potency, no, here I have to write down. Any higher potency, then before coming back, I will write down after class. Before coming back, I have to proceed next to next higher potency. If there is aggravation, then 0 by 3, you have to come back with this 0 by 2, 0 by 1, and you have to use 3 to 1 in different round till improvement is observed. Question number 4. When treatment with 8 potencies, that is 8 cm will be needed, and how long it should be continued. I have written it very carefully, clearly. You can know it very well. For the treatment of intense pathology, yes, very important. And you know who is this and what is the difference between others with us, that is this one. Every subject system, the physician try level best with medicine to give relief from intense pathology. All the therapeutic system, the aim of all the therapeutic system is like this for the treatment of intense pathology. And after treatment of intense pathology, generally tonic and others are given, or biochemic, or in modern medicine, they are ready to give the patent, the tonic, like all these things, and patient is happy. Yes, they are severe. There is hyperpyrexia, and very good physician has given medicine, and it was over within 6 hours. But there is weakness, prostration, severe prostration after when the fever is over. So patient is telling, sir, give me something. Otherwise, I am very tired. I am greatly prostrated. So how can I overcome this situation? I cannot know. You please help me. And physician is ready to give you the different tonic. But see, what is doing here? For intense pathology, there is medicine. But what is the cause of this intense pathology? That is mild pathological state. the responsible group of gene for mild pathological state when they get the chance, when they get scope for becoming overactive, then again there will be severe condition, the intense pathology. But see, only in real homeopathy or genetic homeopathy, there is a scope for treating mild pathology. Nobody else. They are very interested for treating intense pathology, not treating mild pathology. That is the idea. The patient is suffering one after another after taking medicine for that very problem. I was okay for 5 years. Again, the next suffering, it is very critical condition. So I have to suffer with few years interval. I don't know what will become, what will come the next time. I am afraid of that. But what they will tell, they will, other fabric system will tell, see, I have that very all pathological test I have done. But now this moment it is nothing. You know very well that a patient is suffering from tuberculosis. And after dot, patient is okay. And physician will tell, you are having no problem. Takes X-ray, blood test, everything I have done, nothing is there. But you know very well, problem is not completed. Treatment is not completed with that very medicine. So, for mild pathology, treatment should be continued. But in their literature, it is not there. So, they leave the patient. So, after using different treatment protocol, that means 5 potencies, 16 potencies, improvement was there. But now, no more improvement. Then there is scope for treating with the help of 8 CM potencies. But what I have written here, I want to see. For the treatment of intense pathology, 5 potencies of 8 medicines are needed. Yes, you know. But for the treatment of mild pathology, when other treatment protocols are not producing expected result, 8 potencies, that is CM potency of 8 medicine will be needed. Actually, it is done in case of more complicated mild pathology. See, mild pathology also may become complicated with superficial treatment, means symptomatic treatment. This type of treatment protocol, that means 8 CM potency, should be continued till expected results are obtained. 5 potency over, 16 potency over, improvement was there, but now for 1 week, no more improvement. It was remain in a standstill condition. In that case, you have to do that. You have to take the help of 8 CM potencies. And in case of many more cases, there will be gradual improvement with that very 8 cm. I am having a lot of patient. You are also having a lot of patient are using 8 cm. I have written here, but one thing I should say, after 8 potencies, you will see scope of using again single medicine of 5 potencies. If you observe very patiently the patient's saying, patient external appearance, you will understand what patient is telling, with which medicine patient is feeling very good. Then you have to continue. If you see with certain medicine of 8 potencies, 8 cm, with certain medicine, patient is indicating that very medicine was working well. Then you have to come back with that very 5 potency of that medicine, then 16 potency of that medicine. So you have to come, you may come from 5, then 16, then 8. Again from 8, the situation may tell you that again you have to go the single medicine of 5 potencies, again 16 potencies, like all these things. So you should not close your eyes. You have to do all these things with open eyes. Here also I have to add something. When medicine should be changed, that is, when next medicine should be administered. When no more expected result will be obtained after administration of one medicine with different treatment protocol, next medicine should be administered. Very easy. You are using single medicine with different treatment protocol, but after certain improvement, it remains stand still. Then you have to go next medicine. Suppose carbohydrate you are using 5 potency, 16 potency, again 8 cm also. After 8 cm, then there was a scope to give another time that very carbohydrate 5 potency. No, this time the condition is not good with that very medicine. Then you have to go carboanalysis. Like this way, you have to change medicine. When medicines are administered following 6 cycles one after another, I have told you in the beginning, when there is gradual improvement, you have to use medicine of 6 cycles. If there is gradual change. See, after administration of 3 medicines of first cycle, if there is gradual change towards positive, next medicine of fourth cycle should be started following the principle of real homoeopathic therapeutic system. In the same way, medicines of fifth cycle will be started if there is gradual change towards positive after medicine of fourth cycle. Likewise, medicine of sixth cycle will be started if there is gradual improvement after medicine of fifth cycle. So, very easy information, you can use it. 7. when hydrophobinum should be administered in the midst of 6 cycle. 6 cycle was running. When the situation will help you for taking help of hydrophobinum. Suppose after sibilinum, you have started carbophyll. And you are ready to use after carbophyll, then carbonivilis. But if you see, after sibilinum, there was little aggravation. And you are using carbophyll after sibilinum. Problem should be solved. But this time we are seeing after sibilinum, carbophyll is not working well and also creating disturbance, also creating aggravation of suffering. So no question of going to carbonivilis. You have to antidote that very aggravation of sibilinum and also with carbophyll. You have to use hydrophobinum. Again, I am telling, if there is gradual improvement with sibilinum, and after sibilinum there was no more improvement, and then you have started carbophyll. And you thought after carbophyll, it will be solved. But after using carbophyll, you will see, if you will see, there is again aggravation. So, to overcome this state, you have to use hydrophobinum. This is not general protocol, this is exceptional protocol. Hydrophobinum is an universal antidote. Moreover, this medicine can neutralize the adverse effect of all 7 medicines. For example, I have told you one thing I have to write down here. That is, it is, I have mentioned here, hydrophobinum is given, so hydrophobinum is given for the adverse effect. But I should write down here, hydrophobinum will antidote when there is aggravation, not adverse effect. When there is aggravation means, what is adverse effect? For a long time this medicine was used, but after 15 days, this medicine is not working. This is called, or rather, it is doing harm. It is adverse effect. But immediately after using certain medicine, if there is aggravation, if there is any problem, so it is not considered as adverse effect. It is considered as aggravation. Again, I am telling, after using certain potency of certain medicine, if there is immediate aggravation, if there is if there is suffering has increased with that very potency of that medicine. As it is immediately after giving medicine, it is called aggravation. If it happened after few days, it will be considered as adverse effect. So you should mind it. I have to write down here also 1-2 line. When next higher potencies are needed, after CM potency of any medicine, if there is excellent improvement, but not so with 200C potency. And after 3, no improvement is observed. This situation indicates that the individual will be benefited with next higher potency. That means 15, 18, like this. Besides, after use of any potency of any medicine, if there is no aggravation of suffering, rather improvement is observed, next higher potency is needed for the treatment of mild pathology. That is, to inactivate the responsible group of genes permanently. You know that. If there is any problem, the next Bengali class you can ask, or those who does not know Bengali, then you can ask in the Saturday class. When next lower potency are needed? In the previous question, next higher potency, you have seen. And here it is next lower potency. After CM potency of any medicine, if there is aggravation of suffering, and little better with 200C. And after 03, 02, 01, a remarkable improvement. See, there is two separate situation, different situation. Previously, I have told you, after CM, it was good, but not good with 200C. But here you see, after CM, there is, after CM potency of any medicine, if there is aggravation, not aggravation, here also I have to write down something. After CM may not be aggravation, but not any type of improvement. So you have to go 200C. You are bound to go 200C after CM. If there is aggravation or there is amelioration, you have to give 200C. And after 3 to 1, there is remarkable improvement is observed. This incident indicates that the use of lower potencies of this medicine will be appropriate for the individual, which will help for the treatment of mild pathology, that is, to inactivate the responsible group of genes permanently. You will see in case of metastatic carcinoma, this type of incidents you will observe. Which food should be taken? This is another new idea. Generally, patient physician restrict many more food items. But I have seen in place of restriction, you should ask your patient, suppose cirrhosis of liver, and patient was taking wine every day, regularly. And doctor has advised not to take a drop of wine. And patient has come to me. I always ask patient, please tell me which item you feel very good with. Which one? Someone tell, sir, smoking, little smoking. I'll be very happy. I allow it, but not the full portion. Yes, I am agree with you, but only one pound, not more than this, patient tells. Yes, sir, that is okay. And half peg or quarter peg wine, the patient is very happy. As because I have written here, when any food item like sea liver, That type of patient always desire for having fried food, rich food, and physicians always restrict it. But I do. You please give him or her little bit. And very little portion of that very harmful food is given, then the patient will be very happy. But he or she will never satisfied with that. So this situation, this food item, that little food will act as a medicine. Mind it. That very item which can give the individual great pleasure. But if it is given, patient will die. In that very case, you have to give very little. With that very little quantity of food, patient will feel better. That means that very little harmful food will act as medicine. And if that medicine is given with satisfaction, then it will act as poison. I have written here. Same food, you can use it as medicine. On the other hand, you can use it as poison. When allopathic medicine should be continued? Which allopathic medicine should be continued? The medicines is working for a prolonged period. You should not withdraw. You can withdraw gradually, with sufficient pathological report. And if the patient is afraid for withdrawing any allopathic medicine, you should not do it. You have to tell, yes, you may take. Otherwise, that situation will create a problem for the patient. When placebo should be given? In Medipur this time, I have seen a vitiligo case. After using ibuprofen first dose, there was aggravation. Then the physician, my student, was advised, or he himself has decided not to give any medicine. It will be better to prescribe placebo. Yes, for 15 days, it was working very well. That will be placebo. And this month, I have also prescribed placebo. So when the patient is reduced in creatinine, or those who respond intense response, if you see intense response with any medicine, with any patient, then you should prescribe placebo. Of course, you have to observe that very individual, that placebo is working a lot or not. After seeing this, one experienced homeopathic physician, qualified homeopathic physician, he ordered that, sir, we have forgotten the word placebo. I am also, after a long period, oh, yes, I have prescribed placebo this time. And really, patient is happy with this medicine, no problem is increasing, no aggravation. That very vitiligo. when more than one dose is needed out of 24 hours. In case of intense pathology, you may give it. Just now I have got the result from one of my sisters. There are 105 degrees Fahrenheit and no smell, no taste, nothing. So I have considered it is a COVID. And I have advised her CM 0/15, 0/18 and 21 and others every hour. But after 18, no more fever. My sister is now okay. So it depends. In case of accidental case, you have to use it frequently. Higher potency. When more higher potencies are needed frequently, just now I have told you. Hyperpyrexia, severe colic, accidental, emergency, etc. When philosophical prescription are needed, yes, only for this, I am here for you. When philosophical prescription are needed. Last class, that will be physician of Assam. He asked, sir, when we have to use philosophy again? Because previously, for a few months, I have told you, the knowledge of philosophy is not at all needed, as because we are using 3 medicine for first cycle. So all this philosophical prescription has been done. But see, after using different treatment protocol, when you are in a position that you are disappointed with real homeopathic prescription, real homeopathic medicine, real homeopathic therapeutic system, that time philosophical prescription will help you a lot. What is this? You have used 5 potency. You have used 16 potency of 8 medicine, 5 potency of 8 medicine. You have used 8 cm. There was little improvement. Not so remarkable result. Then you have to think over on present pathology. And I have shared my experience with previous class. And following that, you have to again prescribe philosophical prescription. I have written here something. On which basis philosophical prescription of 6 medicines are done. Yes, now it is 6 medicine from 5. How it is, see? At present, you are treating that very individual for few years, maybe few months, maybe, but patient is not improving a lot. Then you have to find out the philosophical state of that very individual. So let's see. You are going to use hydrophobinum as philosophical prescription. But when? If you I told you previously, for being a successful real homeopath, 3 qualities you should have. One is good actor, actress. Second one is detective. Third one is philosopher. That very detective quality will help you to make philosophical prescription. If you want to know what is the relation with others, with your patient, then only you can learn that very individual is heavily attached. His wife left him, but your patient has not left mother. So, heavily attachment. It is a positive hydrophobic. Negative hydrophobic like this. That very individual was having addiction previously. It was started from beginning and today and at this moment also. You will not get that type of patient, may get, but as in my 4 correctional home, there is a lot different types of patient having different addiction. And you have used Drosera many more times. In spite of that, there is horrible attachment with that very drug. Now you have to use that very philosophical prescription with hydrophobia. Again, for Drosera individual, the important criteria, wondering the patient is suffering a lot. In spite of that, that patient wants to wander, wants to travel. And associated with this, he is a good artist from beginning. So the philosophical prescription you have to do it Drosera. See, the difficult portion I have not completed till this moment. And if I want to do it quickly, so it will not help you. This part is difficult and should not be completed in today's class. See, so many portions is so. So next day at this class I will continue with English that portion, the philosophical prescription. Next day the topics will be philosophical prescription. How to do it, when to do it, how long it should be continued. So next class will be in English, regarding philosophical prescription. And after that, this class will be in Bengali. Maybe it will take 2 classes, as because so long chapter it is. So up to this, if you want to ask anything, you can ask. But all easier portion it was. The difficult portion is philosophical prescription. And I have written it in new way, as because so many cases I was not able to control it. But after philosophical prescription, they are now enjoying their life. So it is very important. I want to continue it slowly. Till,
Sir,
yeah,
sir, if suppose a patient is given CVCM and aggravation was there, with you told you go to the hydrophobinum, but without 200 we can't go through hydrophobinum. We have to give 200 first, na?
Yes, yes, yes. Before coming back, you have to
Coming back,
proceed.
we have to give 200 first.
Yeah, yeah.
So another thing, suppose a patient is showing result in the CV. We next prescription we did CA. Then CA is not giving such result. We should give sorinum or we should go to hydrobobinum.
First, you have to proceed.
Yeah, that I'm telling. If CB is giving result, CA is not, then we have to go to sorinum.
Yeah. You should not come back before
Yeah.
proceeding.
So only CB is not giving result, then only we go to hydrobobinum.
Not working. Hydrogram you have to give when CB will do harm.
CB will do harm. Okay. Sir,
That means
suppose
there is
we
aggravation.
do harm means aggravation.
Yeah, yeah.
That I'm telling. If it is giving, if it is aggravation, suppose CM is aggravating, and 200 is giving relief,
Then
then we cannot
I
go.
have told you today
Ah,
everything regarding
then
that.
yes, sir, yes, sir. Now next thing is what I was asking. I forgot just now. Acha,
Okay,
sir,
you
one
think,
irreversible.
think. Now I am taking with Sir Sinhalji.
Sir,
Okay.
I didn't get it. When is the next class? You didn't specify the next class for philosophy.
Next class philosophy, the last part, the complicated part, the new part, new idea. It will be on
When?
third Sunday.
Okay.
Today is first Sunday.
Sir, one thing, another thing.
Yeah,
Irreversible change, irreversible pathology.
yeah,
Started with the Drosera. I
yeah.
have seen if the Drosera is giving, after that we give a civalinum, then hydrobobinum. Isn't it good?
As the present idea is before coming back, you have to proceed fast.
No, that I'm telling now.
So
Suppose
according to this
irreversible,
one, after Dosra, you should go. Sivrainam,
then
if it is
hydrobobinum can
there,
go.
then you have to proceed. Otherwise, you have to come back for hydrophobinum.
Hmm. One autoimmune disease, I have got a result with that. That I told.
Okay, okay.
Hmm.
And it should be. You are right in that very sense.
Hmm.
Before coming back, you have to proceed.
Yeah.
Okay. Let me say
Okay,
good
sir.
night.
Good night. Good night.
Stopping option is not here. Why it is?